most expensive disorder in health dollars spent, behind only cancer and heart disease. On average, it's about $100 billion spent yearly on diagnosis, management, and as well as economic losses. Lower back pain can stem from many causes like congenital diseases, acute injuries, and natural aging. With 6 million cases annually, lower back pain can affect men, women, even kids, but most common in adults 30 to 50 years of age. Lower back pain lasts for 2 to 4 weeks, but can last up to 6 weeks. Treatments include rest and relaxation for your back, and also pain medicines like Tylenol and ibuprofen for the inflammation of your muscles. Here is my interview with Mrs. Zukowski, my physical therapy tech teacher, who is also a licensed physical therapy assistant. All right, Mrs. Z, so how long have you been a PTA or a physical therapy assistant?
Just a little over 24 years.
All right, so within those years, how often do you work with lower back patients?
I would say on average, we would probably do at least 2 or 3 back patients every day.
Every day.
Depending on the settings that we work in.
Yeah.
But even in a hospital setting, we probably would still have 1 or 2 back patients that have had surgeries, various surgeries of their back. But
so
yeah,
you actually see one at least once a day, basically.
I would probably say on average it would be at least once a day. Yeah.
All right. And then, do they get hurt more often at home or while they're at work?
I would say the majority of the patients that we see are not really hurt in one spot. Most of them, it has been a chronic back condition that's developed.
Okay.
There will be a few that we might have seen because of a car accident or a fall down the stairs and injure their back, but more of them are due to the fact that they had a job that they lifted something for 20 years and then ended up with back problems because of it.
So basically, they weren't really properly trained at lifting. They have bad technique basically when they're lifting a heavy box.
Yes, they may have had bad technique with lifting. Maybe they overstrained their muscles 20 years ago and never really went to therapy, decided that, I can just stretch it and put some icy hot on it. And then 10 years later, that has developed into a chronic problem that they're now having to get treated in physical therapy for.
Yep, I know that feeling. We all know ice packs and heat packs is one way to kind of help with the pain. Is there other types of modalities or therapeutic machines you would use for their pain?
They do. I don't do dry needling, but dry needling is a big one, which is kind of that form of acupressure, acupuncture. People will use to do that one. There are different massage techniques like A-stim, which is just using a tool to actually kind of scrape through and break up, scar tissue that's on the skin. They will also use some infrared therapy, or cold laser will often be used as well for modalities to help with pain.
Oh, cool. And then I've read during my research, that back and core exercises help with strengthening your back and prevention of this type of injury. In your clinics, what kind of exercises would you have your patients do?
Primarily, if we would focus on any sort of core and back exercises, we would do all dynamic. Because that's really when you use your core is during dynamic movements, and that's typically when a patient injures themselves. So we usually will have them do things of balance and stability. They'll do core stuff on balls, on any kind of unstable environment, and they'll mimic a lot of motions that they might do in the workplace, perhaps, or activities that they would do at home.
Okay. And those exercises that they do in the clinic, would they be able to do it at home?
Yes, we try to. Maybe some of their their initial exercises, maybe not, because they might be rather low-level exercises, and then we graduate them to doing higher level exercises, and we train the patients to be able to continue with it at home, and usually develop some sort of home program and try to encourage them to do those for life.
Oh, okay, cool. And then I remember you saying that a lot of the people that experienced this that you had in your clinic, they had bad techniques, lifting techniques. Do you think various job sites would benefit from specialists, maybe not even a PT, just a back doctor overall, come visit the job sites maybe twice a month educating them about, strength training for their backs and also proper lifting techniques? Would that benefit them?
I think it would. We have had talks with some colleagues about that in the past. Even some patients that have worked in, at facilities that did little to no back training for their employees, besides maybe having, a paper in the break room stating, keep your back healthy type thing, but nobody really training those workers in understanding that it's not just about proper lifting, that it's also about keeping yourself strong, especially if you do jobs that do require you to lift and pull and tug on equipment all day. And a lot of them don't have a really strong education program for their employees before they get injured. They will do that after, when they're coming to seek therapy, but usually not beforehand. So we've talked about, even in restaurants, I had a patient that was worked in restaurants, and noticing, we were getting a lot of back people that worked in restaurants, and realizing, and they said their restaurant did no training for any of their staff, whether it was kitchen or wait staff, on proper back support and exercises.
Kind of just throw you in the fire and go.
Yep.
All right. Thank you, Ms. Z, for your time.
Very welcome.
Thank you, Ms. Z, for that insight from the physical therapy world. Now, for me, for putting my 2 cents, I've been doing retail warehouse work for over, I'd say about 15 years now, just about 15 years, ever since I graduated high school. I'll tell you this much, when I was younger, I thought my back was good. I thought I could last forever doing this kind of job. My education overall wasn't too great. They showed me a video saying that, this is how you should lift. Call for a team lift if, whenever necessary, if the box was too heavy. Well, when you're 18, you're young, you think you can last, you think you can do whatever, you're Superman. I can tell you this much now, my back ain't nothing like what it used to be. I ain't close to Superman, my strength isn't there. I deal with my back pain on a daily basis now. I take Tylenol for it, I take ibuprofen for it whenever it comes up. I have bouts where the thing lasts me for like a good week or so. Can't do nothing about it but just relax. I just have my wife massage my back whenever she can, but she works as well. And then when you have kids, you have to do everything for them. So there's no time for me to take care of my back. I don't think that's an excuse, but that's all it is. To me, personally, I would have benefited a lot from back strength exercises, even doing it at home. Right now, anyways, I'm trying to do it. But like I said, because of my kids and because of work, it's hard to do, but it's something you gotta do. You gotta find time to do it, and also you gotta try. It's gonna help you out in the long run, I'm telling you that. That's my point of view. So now I have an interview with my sister, Chantel. She's been a dancer she's been dancing hula for 20 years, and she's also been a cheerleader for 20 years. Now she's a coach and she's a teacher. She can give you her point of view on this lower back pain issue. All right, so Shan, how long have you been a cheerleader?
I've been cheering since I was like 10 years old.
How long?
And then I stopped after a little bit, but then I coach now, so like 20 years.
20 years total with coaching and cheering?
Yeah.
How long have you danced hula? I understand you dance hula.
Oh, that was since I was 10 too, so about 20 years off and on.
All right, cool. And then both of them, have you ever experienced lower back pain?
Definitely. With cheer, more when I was actually younger, and now with dance when I'm older.
So when do you feel your pain was worse? During cheerleading, hula, or even during work?
I think when I overwork it, that's when it's worse. Like when I tumbled in cheer a lot, like my back would start to hurt. Or if I danced like for hours on end, then it started to hurt.
How did you manage your pain?
I would take pain medication, and then I would have to ice it after practice. I would have to ice it, and just resting it is the best way to do it with my legs up.
Okay. Were you ever educated prior to cheering or dancing about your back?
Not prior to, but I had a really bad back pain at one time, and then my athletic trainer in high school had to train me on how to like strengthen my back to make sure it doesn't happen
So
again.
like back strengthening exercises and whatnot.
Mhm.
Okay. Last question. So do you think proper education about your back health prior to dancing and cheering would have benefited you?
I think so. Then I like would have strengthened my back before something got hurt or anything like that. But like it's something that you don't really expect to have, especially when you're younger and stuff. So it's not like I expected it to come and then it just happened. And getting educated just helped me get strength before I get hurt again.
All right. Thank you for your time.
Oh yeah, no problem.
Thank you for taking the time in watching my video, and I really hope I was able to open up your eyes to properly taking care of your back, because you only have one.